Man, you're in for a treat. What happens when somebody's on vacation? They're on vacation. But Ellie thought enough of our viewers to say, I'm going to take a short break and I'm going to bring Medicare Made Easy information. And Jerry's in Paris, so we didn't think we could get him from Paris. So, Amelia Island, welcome. So, Ellie, tell our
Yes.
viewers, oh, I'm sorry, tell our viewers who you are, what you do, and who you serve.
Well, I'm Ellie Jolly, and I'm down here in Florida celebrating my wedding anniversary. But still, I'm a senior health and life insurance agent. I'm actually a broker. What that means is I work with folks that are turning 65 and beyond to help them get the most out of their Medicare years and to get the most out of their benefits. So I'm appointed with a number of insurance carriers, not every single one in your zip code. We are required to say that. But I work with a bunch of the carriers here in Georgia. Also, I work Alabama, Florida. Oh, I am in Florida. I could probably do a little work
Hey,
down
you
here.
could run into somebody in the elevator and serve them. Well,
Right.
when I turned 65, I had no earthly idea what I was getting into. And it was like eye-opening because there's decisions that people have to make that I don't think anybody has a clue to what is coming up even now and maybe even a couple years out. So when we originally talked about, the Medicare Made Easy, what would you say? Like, I want you to talk to my seniors that aren't at 65 yet. They're hitting 63, 64. I just had a podcast with my friend Don Keller. He's 60. How soon should somebody be thinking about their options and talking with somebody like yourself before they hit the magic 65?
Right. So you're allowed to apply for Medicare 3 months before your birth month, before your 65th birthday, birth month, right?
Mhm.
So, like if your birthday was in September, here we are in June, you can go ahead and apply for Medicare. I like to talk to people before that. I'd like to be talking to people 6 months before the birth month because there's some things they need to know. And there's some things that are coming next year that are going to bring some changes. I'm still trying to sort through it and what's considered credible coverage and what's not. So I'm reading through that to make sure I'm ready to serve folks because there may be some folks coming off of group coverage next year because it may not be credible, but don't freak out. We're figuring all this out. That doesn't mean that's going to be your situation, right? Um, so we're figuring all that out. But there's some things to know. Like for example, Part A is just that is what you've been paying into FICA for. If you're a W-2 employee somewhere and you've seen FICA on your tax on your pay stub every week or
Mhm.
every 2 weeks or whatever, well then you may have already paid for your Part A. That's one part of four parts of Medicare. So if you're not someone who's already taking Social Security, you'll have to actually apply to get that, to get it started. And you do that through Social Security. So someone like me, I like to help people. I give them the instructions and make sure they know what they're doing. And I'm always glad to help them actually do
Mhm.
that if they'd like an extra hand on that. But that's only one part of Medicare. There's some more stuff to know, and you've got some decisions to make. And one of the things is whether or not you have to take your Part B. So, Part A is the hospitalization part that you may have already paid for. If you
Mhm.
worked 10 years, you paid that tax for 40 quarters. You should have premium free. I'm not going to say it's free, but it's premium free Medicare Part A. That only covers hospitalization. God forbid, should you ever need it, you would have hospice coverage and you would have skilled nursing if you needed to go into like a Medicare approved skilled nursing facility. You'd have it with that. Um, if you're coming off of group coverage, you're probably thinking, well, I really don't go into the hospital all the time. So what about my doctor visits and what about my prescriptions? Well, that's why I said there's Part B of Medicare to cover doctor's visits and treatments and things like that. But what people don't know is that is not free, and it also is not 100% coverage. It's an 80-20 split
Mhm.
between you and Medicare. So that's where your doctor's appointments and certain treatments and like durable medical equipment, things like if you needed a walker or something, that's where all those sorts of things are covered. But it's an 80-20 split. Your share is 20%. And this year it's $174.70 a month in premiums. Now, what I said was a decision has to be made, right? If you're so fortunate to be able to keep your group coverage at work, Medicare may see that as credible coverage and you may be able to keep it and not be charged with a late enrollment penalty for not taking your Part B. There's something there, and that brings up something else: late enrollment penalties. So you want to make sure that you, if you have to take it, that you take it. If you talk with a licensed agent, like myself or someone else in my field, we can help it. We can't tell you what to do, but we'll be glad to advise you on. Okay, so is your insurance at work? Are they going to let you stay on the plan? That's the first question, because they don't always do that. If they're going to let you stay on the plan, well, that's probably, chances are, that's going to be credible coverage, and you might be able to delay taking your Part B. And if Medicare sees that as credible coverage, then they won't hit you up with a late enrollment penalty. If you are supposed to get Part B and you not don't get it, and you don't have what they call credible coverage, then you will be assessed with a late enrollment fee later on when you do take it.
Mhm.
And the
I,
same is true of prescription coverage.
what about, I ran into somebody, and I don't know what the context of why this was the case. It was like a 20% penalty. Is that what you're talking about? Like if I decide that I waive that plan B, and then a year or two later I say, ah man, I made a mistake. And you start in, are you paying a 20% penalty, or what's that like if you don't make that right decision at the
No,
beginning?
it's it goes away. It doesn't go away. So if you're eligible for Part B, which you are when you turn 65, and you don't have credible coverage, like at work, let's say, right? Cobra is not credible coverage. If you're on Cobra, that's not credible. So let's say you're on Cobra and you want to keep that and you skip it. You decide not to take Part B because it's $174.70. You decide not to take it. When you do decide to take it, because you have to have Part A and Part B if you'd like to participate in Part C. Part C is what you see on TV, the Advantage plans, and they sometimes get a bad rap, but those are the most like what you're used to at work. Those are HMOs and PPOs where you get your Part A coverage, your Part B coverage. You also get the
Mhm.
Part B prescription coverage, and you get dental, vision, things like that.
So
Uh,
is Part C doesn't is dental? Because I wasn't aware. So Part C, because you were freezing there, I don't know if it's just because it's the internet,
it's
but
yeah.
what would be like? I don't think I have Part C. I have dental outside. Is that like a decision? Because I did, it's a long history, but Part C, now that I had decided, I mean, not I didn't decide, but let's just say I didn't pick it up at the time. I can't get C anymore, right? Is that
That's
done?
not true. And that's not true. You can still pick up Part C. If you have A and B and you would like to disenroll from original Medicare, we have annual enrollment coming up in October. So October 7th, if you wanted to, if you were someone who was on original Medicare and you wanted to try one of the Advantage plans, you can in October. You can
Okay.
set that up to
So
be
that's
effective
what, when they
January
say
1st.
enrollment period, that's the only time you can enroll for the year.
And
Is that
it's the government, so everything the government, there's about there's a list of reasons we call special election reasons that would allow someone to potentially make change during the year. Um, but for the most part, for the masses of the population, annual enrollment is October 7th to December 15th, I think.
okay?
So annual enrollment comes once a year, but there are some other windows too, and special situations that would allow someone to make a change. But what you may have done, Pete, is when people turn 60, or you can take your Part A, Part A, you need to take it. And if you have a decision to make about whether or not you want to take Part B, and then to complicate things more, if you're like, wait a minute, but that only gets me, that doesn't fully cover me. Well, no, that's why they contracted with private insurance companies like Humana, Aetna, United Healthcare, Anthem, which is Blue Cross, right? Um, and so these carriers stepped in a little while ago. It hasn't been that long ago that Part C became a thing, and they stepped in to say, well, we'll contract and we'll cover everything that Part A and Part B covers, but we'll throw in some dental, vision, hearing. They
Mhm.
all have some various form of some kind of exercise benefit, because they want to try to help you stay healthy, right? And stay active. So they've all got some kind of benefits like that. And those are, like I say, those are plans that they take the place of original Medicare. And those companies are contracted with Medicare and are required to cover exactly what Medicare would cover, how they would cover it. They have to cover at least that. And then they can build from there and cover more. But with those plans, you have copays, right? But listen, if you stay, people don't realize, but if you're on original Medicare and you have A and B, that's not free either. That's not.
Yeah.
It really depends on the person's.
And you have to really sit down and oops, I tell you what's happening. I think the internet is affecting our audio. So I'm going to put your information up here, Ellie, and we'll let people get a hold of you. And, when you get back in town, which you'll be back, let me see. I know I had it here. Let me go.
Next
I got to
week.
get this
Yeah.
because think what happens is, okay, I know I had it here. Hold on here. Where is Ellie Jolly? I know I had it.
Is it
Doggone.
is it Tuesday? I got something from
Yeah.
you about Tuesday.
Okay. I know what we'll do. When you call me when you get back, we'll look at the schedule because I want to give them your contact information before we go because I know I had it up here and I put it up here before we even started. And then I hit a button. Okay, it's not up
Hey,
there. Hold on. All
and if
right.
you can
See,
hear me, I don't know if you can still hear me. I'm going to be talking in July. Gosh, I think it's July 1st. I'll have to check, and I don't remember the time because
you
I'm
know
on
what?
a little bit of vacation brain.
Let me do this. I'm gonna golly day, I just healthcare there. No, nope. All right,
So
one
I'll be
more
talking
place.
at the North Cobb Senior Center, I think July 1st. But
Oh, okay. I was in
I've been
there the
talking
other
a
day.
I've been talking a lot lately about, how to handle all the calls, right? And how to not get scammed, especially during annual enrollment with Medicare. With that coming up, people are still getting calls and they're getting mail, and I know people get very tired of it. So I'll be talking again July 1st. I think it's July 1st at North Cobb
Okay.
about, okay, so how do you handle that? And we're going to dig into all the details, how to get on that do not call list, how to handle and how to report
Yeah,
in the law.
I
Going into
know.
it.
There it is. There it is. Yeah. So
Hi.
if you want to get a hold of Ellie, here's her number 470-315-0810 or Ellie at
Oh,
ejolly
yeah.
dot age. Is that right? Dot agency.
Ellie at Agency. Yep, that's right.
Okay. Awesome. So we want our viewers, and we'll have you on a regular time. We want you to enjoy your vacation, have some fun down there, and be ready to come back and have some more fun. So thank you, Ellie, for being
Hey,
on there from your vacation. We appreciate you. Okay. Thank
there's
you.
no vacation really in the Medicare world. So
Yeah, that's true. You guys work
I'm
very
still
hard.
serving clients down here. So
Yes.
I'm still
Thank you
serving my
so much.
clients.
All right.
Okay.
Thank you.